At Frontline Service in Cleveland, when callers are at the end of the line, there's a friendly voice ready to listen.
Crisis Services, my name's Greg. How can I
and pull them back from the brink.
We do sometimes get those calls that are, hey, I really can't see a way out, and I need help.
Offering support and resources to help overcome mental health trauma.
Okay, so what's going on with you today?
When Cuyahoga County callers dial 988, the Suicide and Crisis Lifeline, that call for help
Sure you can.
ends up here.
988 hopefully will become as familiar as 911.
Rick Oliver is the director of Crisis Services, which includes their 24/7 call center.
So that would make you feel overwhelmed and depressed. So
Our call volume is the highest through the national hotline in the state. We average about 150 calls a day. So just a couple years ago, it was 120 calls a day.
Veterans who dial 988 have the option to press 1 and connect to specialized services elsewhere, but not all do, and those calls end up here too.
89% of the veterans now are male, so they've had training with weapons. 75% of veterans who do die by suicide use a firearm. So there's some risk factors that are built in with veterans, like from the start.
The Centers for Disease Control and Prevention reports veteran suicide deaths are increasing at a greater rate than that of the general U.S. population.
people crying out for help, just helping them vent, help them process. It's just people that's hurting and need assistance.
They're thinking about it, they're planning for it, they know how they're going to do it, they know maybe when they're going to do it, but they're ambivalent, so they're going to reach out for help. That may be our one time to help that individual.
The intervention specialists want people in crisis to know.
And just by being able to talk for a bit, sometimes that's all people need to get to a place where, at least for that day, they're safe.
Callers' needs do not have to exceed their resources. Dial 988, a lifeline for help.
People have called us back and said, that call, you saved me from doing something that I didn't want to do, but I was planning to do. So I think we do save lives every day.
In Cleveland, Maya Belai.
Take care. Bye-bye.
Bye.